Welcome to today's episode of Sam Talks Telehealth. I'm excited to be joined by Dr. Kike Oduba, who is an infectious disease prevention and control and public health physician from WellnessWits. I'm excited she's going to share about managing chronic disease using shared medical visits. So let's jump right into the podcast.
All right, Dr. Kike, I'm so excited that you are here with me today. And as I mentioned to the audience, we know each other outside of this podcast. So welcome to the show.
Thank you for having me, Sam. Always exciting, to have a conversation with you.
Yeah, I'm super excited. And for the audience, Dr. Kike and I know each other. I'm an advisor with WellnessWit, her company. I think what she's doing is fantastic. And so I wanted to make sure I have her come on and share what she's doing. So let's have you do a quick overview of who you are and what you're up to.
So I am a public health physician. I've always been pro population health and anything that has to do with people. I'm interested. And so I've mostly worked, with local, state, and federal government entities, in public health and developing population health solutions. But during my career over the past like 7-8 years ago, I had a personal experience of a chronic disease, which is thyroid autoimmunity, that, kind of led me through a patient journey that brought me into entrepreneurship. And so I guess as we continue to talk, you would learn more. But I entered into entrepreneurship, out of a necessity and a need that I saw. And so I started this company, WellnessWits, where we help people, with chronic complex diseases manage their symptoms. And over the past 2 years, we've pivoted into helping physicians deploy group programs in their practices to help patients with chronic diseases, like help them manage, issues in between appointments and time in the clinic. So that's pretty much my background in what I'm doing currently.
I love it. Okay, so group visits, like when I always think of group visits, I think of our somewhat traditional, pulmonary rehab or cardiac rehab. Talk to me a little bit. I think it's not as common, the shared medical visits. Talk to us a little bit. What does that mean? And, how does that work?
Okay, so I call it group therapeutics, which is pretty much, putting a group of patients with similar conditions, with similar health issues in a group and managing them together. So this is also known as shared medical visits, and it's a phenomenon that has been in existence since the 90s, actually. It's more popular for diabetes, it's popular for things like hypertension, but primarily for, any chronic disease. And so the way shared medical visits and group therapeutics, if you would, works is that you kind of identify patient needs based on their specific diagnosis and begin to create protocols and, clinical vignettes that would benefit that group. The way it works is such that the physician is able to carry out follow-up activities, in a more streamlined way so that they can spend more time with the patients. And at the same time, they're spending less time with one-on-one follow-ups, right? In between that also, you have other team members helping out with the management of these patients, including maybe psychotherapists, dietitians or nutritionists, health coaches. So it's a collaborative effort, to help the patients feel well. And the benefit to the patients is the fact that they have a lot of peer-to-peer support. Also, they're able to, bounce ideas off each other in a group setting, like, oh, how did you manage this? How did you manage that? And for rare diseases that like autoimmunity in certain circumstances where patients are not textbook cases, like in my own case, right? I had thyroid disease. I first had Graves' disease that slipped over into Hashimoto's. And on top of that, I had something you would call idiopathic purpura with angioedema, which the doctors could not really figure out. And many of the symptoms I complained about, they were like, we can't see it in your test results. So I joined a Facebook group of thyroid disease patients, and lo and behold, everybody had my symptoms. And most of them were like, my doctor, cannot really relate with what I'm talking about because they're not seeing it in my test results. So where that, really made me think was doctors are not in these groups seeing or hearing what these patients are saying. And so I, decided, so I have a friend who, who has a gastroenterology practice who I talked to about group programs. And I said, how about we try this out? And she did. And we saw tremendous results, how that patients would be in a group setting with their physicians, they can ask questions and they feel like they spend, because these visits last an hour, right? They feel like they're hearing everything, from other patients that they thought they didn't understand, which they were going through. And so it's a kind of enlightening experience for doctors when they put their patients into groups and say, oh, all of these patients have the same issues. And so they're able to actually offer treatment, that is specific for that therapeutic group. And the results are usually very positive. Most of these patients come back from like after the first visit, they keep coming back for other visits. So that has been my experience with group visits. And the good thing is now that insurance companies are open to, reimbursing for these visits because, the CMS has put out a statement saying that when you see patients in a group setting, you can as well bill for that visit like you would your one-on-one. So that has helped certain physicians actually embrace the idea of shared medical visits. And on top of that, they're able to offer chronic care management and even remote patient monitoring through this group visit. So it's like streamlining workflows, increasing efficiency, increasing patient engagement, and the results are usually positive health outcomes. On top of that, improved medication adherence. The patients are well educated and informed. I always tell doctors that a well-educated patient is a compliant patient, is a healthier patient, is a more cooperative patient, and of course, a happy patient. So those are the things that I found interesting about group therapeutics. And I think it's an exciting future for the healthcare industry if more people, begin to embrace this model of care.
Yeah, I think everything you said is, and I want to dig on a couple things because it's part of the reason I love what you do and why I've been so excited to be able to partner and advise with you. Right. Is when we think about, let's take thyroid, right? Yeah. If I go into whether it's my primary care doctor or the person who's doing my active thyroid management, even if I go into endo or something, right? If we're busy, those docs are busy. So if they only have that 30-minute follow-up slot, we don't have the time to go through every little thing. And so patients can feel like you're not listening to me, you're not hearing me, you're not helping me. And what we have seen a massive rise in, just like you visited, our Facebook groups with coaches. And we're not here to bash on coaches. That's not what we're talking about. But we all know there is a difference between medically trained, whether it's medically trained nutritionists, medically trained physicians, all these medical training, and these ad hoc groups. And what we also know is the groups, people who have been able to do great things with their own healings. Again, we're not discounting any of that, but patients pay to be in those kinds of things because they're helpful. They feel seen, they feel heard, and they're able to solve kinds of things. So talk to us a little bit about this idea of how do we bring this same, level of empathy, level of understanding through something like this, but through a medical model.
Right. That's an amazing question. So the way it works is, all of these groups that we're creating are physician-led, designed, and owned. And so when patients hear that my physician has a group of patients just like me in a room, and they're seeing them, examining their symptoms, answering their questions, and dismantling misinformation, they feel very comfortable. And so that's what makes it different from Facebook groups and other groups out there. Unfortunately, there's a ton of misinformation, right now in the world, especially with the pandemic and all that, and doctors can't keep up. So this is an opportunity for clinicians to actually take control of the narrative in medicine now by hosting patients in a group setting, educating your patients, you're giving them the information they want to hear. Because you go to a doctor's of many patients now come in with Google, like papers with Google. Things they've Googled and said, doctor, I read this. What about that? You don't even have time to listen to that. You don't even have time to read all of that. But then the patient leaves feeling unheard, right? And so if you take a proactive measure to educate your patients, let them understand exactly what you want them to know about their specific condition, their medications they're taking, their nutrition, their lifestyle, it makes a world of difference, right? The patients feel more empowered. They feel more partnered with their physicians, with their clinicians. And so, as much as, and the good thing about group therapeutics is also that all these people you see online creating groups are incorporated. All the back-end work when it comes to charting, nutrition, monitoring, remote patient monitoring are done by health coaches, health educators, nurses, and medical assistants. Even the physician doesn't have to be, 100% involved in the whole process. But as long as you're the one leading the pack, we call them virtual care teams, right? Physician-led virtual care teams. So if the physician has oversight over all of this going on, so even if it's the health coach running the group, it still works as long as it's under the supervision of a physician. So that what makes it different. That's what makes it even more powerful and impactful for patients, because they know they have the safety of a licensed physician or clinician working with them within this virtual care team. I don't know if that makes sense, the way I described it, but it's a very different ball game when it's a physician handling these groups. And it's super, super impressive, the results you can get from that.
Yeah, and I think that's exactly what I love about this program, is that it does allow physicians who, again, are very busy, if you're a primary care or you're a specialist, but all of these, it's like these outlier chronic types of things, my IBS, my, thyroid, all these things that are like, oh man, this is chronic management. I don't have the time to do it when they come in here. And I'm also afraid they're on some Facebook rabbit hole with, the latest, whatever. Again, we should eat healthy. We should do all these things, right? But not these strange fads that then have a problem with how do we look at it medically.
For a short break in the podcast, I want to talk to clinicians out there who'd like more resources and support around getting on the camera. We know you've been doing it for well over a year, but there's still some things that can always help you present just as professional as in clinic as you do on camera. So for additional resources, I've created a workshop called Camera Confidence for Clinicians. You can find that at telehealtheasy.com/camera. And that's a workshop to really help you get more connected with your patients, feel as professional in person as you do on the screen. And it's a nice workshop to be able to give you all the tools, checklists, and some really easy hacks to make it, less overwhelming to be on camera and not so worried about, the second chin or any other variety of things. But we've got you covered. telehealtheasy.com/camera for a great workshop on improving your virtual health visits. And with that, let's get back to the podcast.
So talk to me a little bit on that chronic disease side. What are some of the chronic diseases or pathways that you have right now that you partner with physicians to be able to help them manage?
Awesome. So I have helped, I've created a few programs like a diabetes, prevention program that's very popular. Even the CDC has an incentive for physicians to do diabetic programs, most times in groups. So that's popular. We've also done this with thyroid patients. We had a 30 patient group of thyroid patients whom we walked through the process, of group therapeutics, and it worked phenomenally. And also we've worked specifically with a physician who is a gastroenterologist who had, over the past few years, she had gathered like maybe 10,000 patients in her practice whom we just sent out this email blast to invite them to join the groups. And, we deployed 3 groups in her practice, and every single one of those groups came out very impactful for me, because I thought, wow, look at how much we could achieve with these patients. So one of the groups was the elimination diet program, which people found very difficult. The good thing about an elimination diet program is it's diagnostic and also therapeutic, right? And so patients come out of this program feeling like, wow, like I feel great because you've eliminated all the junk foods, you eliminate pro-inflammatory foods. On top of that, anything that is toxic to them in the environment, they've eliminated, and they feel great, especially knowing that their doctor is meeting with them every 2 weeks to manage and monitor their progress. Another one that we did was weaning off PPIs, right? A lot of people have heartburn, but they keep using PPIs, acid blockers, but then it's like they keep getting more dependent on it, like they keep increasing their doses. And so she was like, let's put these patients in a group and see if we can wean them off. But it came with a lot of assessments. Are you even eligible for a wean off, and then taking them through the process of actually to not just wean down on the prescriptions they're currently on. So that really helped, seeing a group of 30 patients, right, going through the same process. Some who had problems weaning off, were able to get ideas from their peers, like, oh, I took this out of my diet and that helped, and then when we're in these group sessions together, the doctor is answering questions, they're asking, for more answers and clarification. Some of them went online and dug up information, and the doctor was like, no, that's not true. This is how you go about it. It was just such a rich experience. And so we've been able to do this in different things. Like we've talked about gastroenterology now, we've talked about endocrinology, and of course, primary care. So I imagine this is also possible in cardiology, patients who have cardiac risk, like high cholesterol, hypertensive patients. You can put them in groups, and manage them because they're all chronic diseases. Even arthritis, arthritis is a condition that stays with you for so many years, and pain management is also a huge deal. So grouping patients, and one thing that I've noticed with chronic diseases, which I experienced, is isolation, right? You're isolated from your family who really don't understand how you feel. For many years, I felt people thought I was lazy because I would drag out of bed. I couldn't do anything. But then when I found myself in a group of patients experiencing the same thing, I was like, see, I'm not crazy. I'm not lazy, right? And so it was just amazing to see that the isolation literally kind of goes away when you see other people like you. So I believe any chronic disease that makes people feel isolated, like people with arthritis, autoimmunity, that's another big one. Mine was also autoimmune, right? We're talking thyroid, but ultimately it was autoimmune. Autoimmunity is a big one where a lot of people just feel trapped in their own body and the symptoms that they experience, and they kind of cope with it. But until they start talking about it and they feel like they're, sharing their experiences, then they begin to feel validated and feel like, okay, I'm getting somewhere here. I'm beginning to identify my problems and somebody's listening. And, when your physician can understand you like that, you feel like you're making headway, and it really helps you mentally even. The psychosocial aspects of chronic disease is a big deal. You deal with those things in a group setting, it's a very impactful experience, for patients. So you can't limit the amount of, people you can help when you begin to open up yourself to other opportunities to help patients beyond the traditional one-on-one face-to-face visits. So I think it's a great opportunity, for us in digital health, really, to begin. And the good thing, everybody's going digital, right? It's all telehealth now, right? And so with that, doctors can sit in the comfort of their home and see people, 20 people on a Zoom call. And there is a way to go about these things. I know there might be questions about confidentiality and privacy. According to CMS, as long as the patients voluntarily opt into these groups, you're fine, with HIPAA and all that. And of course, the group is close-knit, everybody understands the rules, there's always pre-visit forms they have to fill and sign. So when all of that is taken care of, everybody's got an understanding, the patients understand. And quite frankly, many of them find it fun, they kind of love it. I was initially concerned, like, how will patients feel like my doctor is treating me in front of other people? But ironically, many of these patients loved it. I've read a lot of research papers on this. This is something that is going on in the Netherlands. People do it, doctors do this in Europe. I think it's a very popular model in Europe, actually. So I'm thinking the United States and North America would actually catch on to this, group therapeutics wave that we're experiencing. So I guess there's no limit to what we can achieve if we continue to put the message out, like you doing telehealth easy and, educating doctors and all of that. So
Yeah, I mean, I think what I love about this, and because we definitely know group visits have efficacy and we've seen them, through the years, but it had really been concentrated in these, like, the specific, American Diabetes Association diabetic group visit. There's like a code for that. And then it was like, cardiac rehab, and there's a thing for that. And pulmonary rehab, a thing for that. And when we've done those virtually, again, same, the patients are so excited because there's people like them. And just like, had they done that in person or virtually, these people are like me. What I love about what you've created, Dr. Kike, is that you're actually coming with all this other variety of chronic disease, of what we know providers don't have time to manage, because there's no way they can manage it. We're not in any way bashing on them. We're saying there's no way you can manage it. You can't have enough case managers. You can't have enough people to manage all this. You don't have enough time. And here I think part of the reason it's probably so popular in Europe is because they have nationalized health systems. So they have a value-based health system, right? There's a wellness incentive. Unfortunately, we're in a fee-for-service environment. It's not as great. But here you have been brilliant to find a way to say, how do we use what we have, which is fee-for-service, and we can back in something that is highly effective so that a provider now sees 30 people at once with an entire virtual team who supports them after their woohoo, I'm here for 30 minutes. I'm checking in with all of you. Oh, okay, we're answering questions. Now your continued virtual team is going to take this over and manage you. And again, this isn't about, I think another things we see in traditional, like hospital systems and stuff, is there's a concern that groups who come along with some kind of additional benefit will then be like taking those patients, right? Because like maybe primary care or GI can't manage the IBS, but if you send them somewhere else, you may never see that patient again. What I love about what you've created in the virtual team is this is what you're doing. You don't have a motivation of, I want your tests later. I want your procedure later. I want these patients for my patient panel. It's literally coming along and saying, I've got a shared medical visit that will help you do X, Y, Z. How can you see 30 people at once and get paid for those 30 instead of seeing 30 people individually and still not actually being able to manage their chronic disease, because all you could really do was find out what were you trying to rule out.
Exactly. And that's so true. And the good thing about this is we can set goals for the group, right? Even though the physician is managing individually. And what makes it even more powerful is the fact that we can utilize technology to handle over 50% of the tasks involved in this, right? Before the patient shows up for the group visit, everybody already filled out a form. right? The assistant, the health coach, health educator, or the nurse or the medical assistant already read through everybody's chart. The patients have already logged, maybe their foods or their mood, their symptoms ahead of time. All the physician is coming to do is just sit, monitor everything going on, answer questions. And after, the good thing is also the fact that we're not eliminating one-on-ones, right? We're just streamlining. So for those who need to be escalated into one-on-one visits, can it be easily identified from the group? So everybody is seen, but then those who are high utilizers can easily be taken care of outside the group. And another thing is for many people with complex chronic diseases who don't have one diagnosis, they have multiple diagnoses. We're trying to, kind of make it a more integrative, like a more integrative system where everything is taken care of, but by different people, right? But we're utilizing technology to manage all of these little things. And on top of that, you're offering, food journaling, health education, you're offering even, what's it called, lab tests through, this whole group thing, because everybody can easily get their lab orders done at once, right? As a group, like everybody's testing for this during the season. And so when you're able to do that and even write prescriptions and do medication management for the group, you've literally saved yourself almost 50% of your time, right? I read an article that said in 2018, the American Board of Physicians did a research, and they found that physicians spend at least 50% of their time on EHR documentation. Like that's a ton of time you're spending doing that for individual patients, right? Individual patients. So you're spending almost 20 minutes. That's outside the visit time. So if you're able to do it for a group of patients, right, with the help of allied healthcare providers who are not licensed physicians, but they can do these things for you, then half of your job is done, right? You're not trading time for money anymore, and you're being more, how would I put it? You're being more proactive in managing your patients, because there is just so much need out there, so much to do, but you really cannot do everything. And of course, with our current situation in the healthcare industry with the pandemic and everything, there is a huge burnout problem. And I think group therapeutics would easily help reduce the burden. It would help us identify who really needs the one-on-one care and focus on them. And also we reduce hospitalizations, right? And emergency visits, because then, like I said, we're being proactive. So for me, this is a public health thing. This is my forte, right? We're dealing with the population in such a proactive way. We're preventing disease, and we're also helping people who really need the help. So it's amazing. And like I said, the E&M codes that you would use for one-on-one visits are the same exact ones that are applicable in the group visits. Isn't that awesome?
I know, it's so amazing. And that is, why I love it. And, wanted to make sure that my audience sees it. Again, I work as an advisor with you. I know you in the outside world, but when I see things that I think, let's make sure I can share with my audience, I want to make sure we do it, because I absolutely love what you're doing. And I think it can really transform practices who have chronic disease in them, which we even know most do. So where do people find out more about the WellnessWits?
Yes, we have a website. It's www.wellnesswits.com. And we're going to put out like a little white paper for, physicians to go read. So when we would put the link in the podcast information, right? And so anybody who wants to go get more information can always go there and see. And of course, on our website, we already have all our groups that we're currently running available on the website for people to go look and see what we've done. There's patient reviews there. Like we have over 15 patients who wrote about their experiences in this group. Just go there and read what they wrote. It would blow your mind how, satisfied these patients are. I was there worried, like, okay, maybe, people don't want to be, talk to about their health conditions in front of other people, people are like talking and sharing and like, because they have an hour with their doctor. So, I mean, so when you go on our website, you see all that, information. And we have a form there as well for doctors who want to just get more information. Like we offer free consultations to doctors who want to start. We show you how to start and we show you how our own team can help you. And of course, our platform is available for doctors to onboard and come on and just use and share their own information with patients in that platform and also run their own group programs. And of course, doctors can also take some of the key here is the content we create. So the way we've done it is we've created content for different therapeutic groups, right? We have for GI, we have for endo, we have for autoimmunity, thyroid, and we also have for just plain nutrition, right? We also have for diabetes. And all of that content can be put in any EHR, right? For the doctor to put out for their patients. And when they do come for group visits, they can always ask questions and bounce off ideas based on the content we've already created. We also support physicians with marketing, right? We write out, a lot of things is very, very centered around medical communications. And of course, as a physician, I've been able to master the patient's story and understand what they want to hear and what they shouldn't hear from the doctor's perspective. A lot of tactfulness has to come into play with all of these things. So we have a whole team of medical writers who write these programs, write out the marketing materials, and we share these things with the doctors to share with their patients. And when patients see these things, they're able to, opt in, right? And accept the invitation to join the groups. So typically groups run for, like, if you want to do a specific group for a period of time, it could run from 4 weeks to 3 months, right? Another option is to do something they call DIGMA, which is drop-in group medical appointments. It's called DIGMA. It's an old term, it's something that has existed for many years and doctors don't know about it. So when patients know that my doctor is going to be on Zoom like every Tuesday at this time, I'm going to drop in for that appointment. So yes, doctors can host that, like decide that one day a week, I'm going to dedicate that day to seeing patients in groups. And so all my hypertension patients can come see me on Tuesday and drop in, right? And when they drop in within that 1 hour period, you can bill everyone who showed up during that hour for that visit.
Love it.
Patients, it removes the waiting time. There is no waiting time because before the moment the patient books, we send an alert, fill out this form, right? We've already seen, because these are all, by the way, we need to mention, this must be for existing patients only.
Right.
All new patients must have a one-on-one visit first with the physician. All of this would not make sense because it has to be a patient you already know. So for people who come into the practice as new intakes, we usually take them through a different process. We assess them, we do the physical examinations and all of that, and then we funnel them into the groups, right? And so, like I said, the doctor can do that DIGMA model where you're setting a time, 1 hour period to see patients. And when the patient list exceeds 15, you cut that off and open up another visit if you need to, right? So there could be a wait list, but the thing is just focusing your energy during that 1 hour on all those patients and allowing them to have that ample time with you in a clinical setting digitally. So
love it. Love it. And really for all the, physicians watching, or if you're a practice manager, I love what Dr. Kike is doing. I think it is really, really exciting. And it's taking us from that. Yes, we want value-based, but we're not there yet. And until we are, then this is the type of thing that can support our chronic disease and have incredible outcomes. And also then your people aren't on strange Facebook groups getting information from whoever they feel like. So it actually allows you a much deeper connection with your patients through that patient relationship. I will have all of the links. I'll have the links down there, but I definitely encourage everyone to go and take a look and speak with Dr. Kike. I think this is a really, really exciting exciting program. And of course, why I'm also excited to get to partner and be an advisor on it. Dr. Kike, thank you so much for joining me on the show today. I really appreciate it.
Yeah, thank you. It was a delightful conversation, and I see a lot of great things coming out from this new era of digital health we're all in. And well done with telehealth easy. You've made it normal for us to all want to do telemedicine. So thank you so much for having me.
Thank you.
And that's it for this episode of Sam Talks Telehealth. Isn't it awesome to get a chance to talk to providers, learn what they're doing, how they're doing it, and what they see as the future? Don't forget to subscribe to the podcast so you know when we're dropping everything new. And of course, you can always visit me personally on telehealtheasy.com. We'll see you back here next time.